breast patients in particular. We work on a lot of other patients here in the area, but the majority of the patients that I see, I come to me through mammography, so I'll use that as an example. For my ladies that come in to mammography and it's deemed necessary to have a biopsy, I'll work with that patient from that point on. After she has a biopsy, we start to develop a relationship. I may not know the outcome of that pathology, but I call her, ask how she's doing, make sure she's doing well the day after the biopsy, and then we start talking about when those pathology results will be available. She'll come into the office and she'll meet with me and we'll talk about those pathology results. At that time, I'll help get a team together as specialists, which will be just like the gentleman to my left. And so you'll need a medical oncologist like Dr. Johnson, you'll need a radiation oncologist like Dr. Harris, and you're gonna need a surgeon like Dr. Wilson. That makes up a team of specialists that a patient would need. In addition, I provide them a means to stay organized. It's just a binder, but it's a beautiful binder which you put all of your imaging and your pathology in. Also in that binder are some other resources that are available. Many patients are scared. They don't know what's going to happen next, and they don't know what to ask those doctors when they get into the office. Sometimes we just shut down because we're so scared of our diagnosis. When I sit down with a patient in that binder, they really have an idea of what to ask those doctors. So when they go in, every little section is divided into helping those patients formulate the questions that they're gonna feel better knowing the answers to, and their family members. So as a navigator, I help set those patients up with physicians, and then it's a continuous process of helping them get to the necessary tests, such as imaging, additional imaging, maybe an MRI, maybe a PET scan, maybe other imaging that the doctors need. I take that patient at that point and we present them at a multidisciplinary tumor board. It's a meeting that we have twice a month with these 3 physicians and many others, and it gives an opportunity for those doctors to collaborate. And we discuss all of the cases. They are able to review it with the pathologist and ask him particular questions about the tissue and how that tissue responds or is responding in the body and how the body is reacting. It helps them know what that patient will need, whether it is targeted therapies or chemotherapy or maybe just surgery and radiation. So in that meeting, all the doctors are able to communicate. Sometimes those cases are pretty clear cut, and they're able to say, oh, okay, we know exactly what we need to do. Other times it gives them an opportunity to discuss different therapies with the other physicians that are also in their specialty, or to be able to coordinate the care. Well, we're going to do surgery first, and then maybe we'll do chemotherapy or targeted therapy, or maybe we'll do radiation. And that whole scenario can be different with each and every patient on which therapy needs to happen first. And it gives them all an opportunity to work together. I can say on behalf of all of our physicians right here in this area, they work so well together, and they keep great communication with me. If a patient is in need of something, they'll reach out to me and say, can you help get this? Can you help the patient with this or whatever? We also offer genetic testing here at Davis, and I'm able to use a variety of laboratories that can meet patients' needs for the type of cancer that they have. It's a real easy blood test, and for some cancers, it provides vital information for them. So those are some of the things that I do as a navigator.